I had the pleasure of sitting down and talking with Tara Devi Labar. Tara has been a nurse in Bhutan since 1999. She started with a diploma in general nursing and midwifery. In 2009, she upgraded to a bachelor's in nursing from Melbourne, Australia, and worked as a clinical nurse in various hospitals in Bhutan. In 2011, after completing a master's in public health from Bangkok, Thailand, she started as a lecturer at the medical university in Bhutan. In 2014, Tara came to know about palliative care and became increasingly interested in the subject. Tara completed her PhD in Western Australia, where she currently lives with her family. She's very passionate to continue to contribute in developing palliative care, a concept emerging in Bhutan. Hi, Tara, and thank you so much for taking the time to have a conversation with me today.
Hi, Rachel. Thank you. Thank you so much for having me. Actually, this is an absolute pleasure, and I'm happy to share my journey into palliative care and developing palliative care in Bhutan.
Fantastic. On that note, I know that you have such an incredible story. You have had an amazing journey in your profession, but also personally. And I just would love to hear you tell the story of how you discovered what is palliative care.
Sure. It's a very unique story, I personally feel. In Bhutan, I've been a nurse since 1999, and I mainly worked with children at the National Referral Hospital those early days when I was working as a nurse. Later, I became a nurse educator at the medical university. But those days, I've been a nurse for almost 12 years, from 1999 to 2010. And I never heard anyone mentioning about palliative care. I did realize that children died of advanced illnesses,
Mm-hmm.
families struggled, and healthcare professionals also struggled not
Mm-hmm.
being able to care for the child and the family holistically. But then I personally thought we were giving them medical treatment as I was giving the child the prescribed medications, whatever limited they were. I didn't realize those were limited those days. It was around 2014. I actually met a patient at the National Hospital when I went to visit him with my nurse student who chose this patient for a care study.
Mm-hmm.
And I went to see this patient who was admitted in a private cabin in the National Referral Hospital. And this patient was a 44-year-old monk, and he was diagnosed with an advanced lung cancer and had bone metastasis. When I saw this patient, he was in severe pain. I noticed him in such a stress that the whole family around him were very distressed as well. He had two of his siblings next to his bed, and his elderly mom on the other side of the bed. This monk was in so much of pain that he was restless. He was like, he wanted to get out of the bed, and he just didn't know how to, care of his own well being. And nobody else in the room were comfortable as well.
Mm-hmm.
My student and there watching him, because we were also, we couldn't really be sure how to help him. And his mom, his elderly mom, started asking us. She started venting out, actually. She said, my son has been a monk for the last almost 40 years, and all he did was good for the sentient beings. He neither used alcohol nor used tobacco all his life. And today he's suffering like this. Can someone do something about it? And that really touched me, actually, and just didn't feel comfortable to stay in the room, to be very honest, because I was feeling very helpless. So we listened for a while. We witnessed what was going on, but the room, when I checked and discussed with the nurse in the cabin, and I checked that the monk was on regular Panadol and ibuprofen prescribed 3 times a day. And he was actually just given Panadol and ibuprofen at 2 p.m. And I think we were there around 2:30 p.m. I thought that was it. And everything was taken care, medicines were given, and we left. But that scenario actually touched me so much. I came to this, I Googled and I said, cancer pain management. And there it started popping up about palliative care as well. And then I became increasingly interested into this concept of palliative care because it also mentioned not only medical treatment, but also much more than that. It said it can take care of the psycho issues, social issues, spiritual issues. Oh, that's it. Then it really, really caught my attention. And then I increasingly became interested. And I started sharing about it with my colleague, my who shared a office space with me. And so we together discussed about it. Each time I read something more about palliative care. And then, as nurse educators, we often go to the sites to supervise our students. And then my
Mhm.
colleague would come back to me and say, oh, Tara, there's one patient in severe pain. I think she needs palliative care. Can we go and help her? Can you go and talk to this patient and the family? And that's how it helped me learn more about palliative care. I would go to this patient, whoever my friend would ask me to, and then I would talk to this patient and listen to her story, listen to his story. One patient I clearly, vividly remember was this 23-year-old girl who had road traffic accident and had a spinal cord injury. She was admitted in the orthopedic ward and was one of the repeated admissions she has had because of the massive bed sores that she developed because of her condition. And so I went there and I was talking to this young girl. I was listening to her story basically, and she told me the physical condition is taken care, like the wounds are being done, the urinary catheter is being changed. But what really not being able to handle was that she has a 2-year-old daughter
Mm.
and her husband has recently left for another woman. And that really was story that I least thought was going on in a patient, you know?
Mm.
Okay, so I thought, okay, palliative care, not just medical treatment, not just physical symptom control, but this patient is in need of much more support to help her move on with what's going on in her life. And so that's how I actually learned and to say moved on with this palliative care concept beginning. And then
Mm.
in 2016, I got this very, very unusual, beautiful opportunity, a 6 weeks hands-on training in Kerala, in Paliam, India, in the office where I worked at the Faculty of Nursing and Public Health. The dean announced that they have got some Government of India funding. I thought, okay, I will explore for palliative care training. Didn't have any idea whether existed in India, but then because those days, I really had these challenges exploring online. But
Mhm.
then one of my colleagues also agreed that, okay, I will also go with Tara, attend a training in palliative care. And her roommate was a young nurse educator who had studied in India. He did his bachelor's of nursing in India. And then he was very comfortable with technology. So he helped us find course in India. We were warmly welcomed in Kerala. Dr. Rajagopal was the chairman of the organization. Dr. Raj is father of Indian palliative care medicine.
Mhm.
Two of us, I believe, were the first international and especially the first Bhutanese attending this training. So we were attending OPDs, we were attending inpatient care, and we were also visiting patients at home. The experience we were gaining just kept us going. Came back to Bhutan. And then two of us decided, let's do some sensitization presentations to some relevant stakeholders where people will get to know how important palliative care is, that it is not really necessary to be a rich country to be able to provide palliative care. In Kerala, we realized that we can do home palliative care, we can do community palliative care, and that palliative care can be provided according to the context we are in.
Right.
So that's what really motivated us. And so we put up to our management at the Faculty of Nursing and Public Health, and the management invited officials from the Ministry of Health, from the Medical University, from the National Referral Hospital, like the nursing superintendent was there. I think the medical director was there. So important people were there. And we also had the founder of the Bhutan Cancer Society, who
Mhm.
founded the society after losing her dear mom to cancer, because those days we didn't have any organizations that would support cancer patients. And so later, the founder of the Bhutan Cancer Society became the health minister. That was like few years later, but that's how we got these important people on board to attend this
Right.
sensitization we made, you know. Soon afterwards, 5 nurses from the National Referral Hospital were sent to Kerala for the same training.
Right.
And then things started happening, you know, after they came back. They were posted in the oncology ward where they would receive cancer patients. And so part of their care was also palliative care.
Hmm.
And after that, more nurses were sent. Then the other milestone was in 2017 that we facilitated. So me and my colleague who went to Kerala,
Hmm.
her name is Punso Om. So two of us facilitated to the organize an international cancer control and palliative care workshop funded by ASCO, American Society for Cancer Oncology.
Hmm.
So then we had very experienced faculty, uh, you know, from Singapore, late Professor Cynthia Go, Dr. Raj from India came, and other faculty from America came there. So we had this amazing week-long training. So 3 days were devoted for cancer control, and the next 2 days for palliative care. And that's when our doctors and nurses in Bhutan really got introduced into the concept of palliative care.
Mm.
And in the meantime, I was exploring to study a PhD because I was an academic and I had done a master's in public health. So as an academic, I thought like, okay, PhD would be an appropriate, opportunity. But then I was waiting for the right subject to study a PhD. And when I came to know about palliative care, I started exploring whether I could do a PhD in palliative care. And so I considered Australia, and very luckily, it didn't take long to find professors who were interested to be my supervisors. So I could get 2 professors, and one of them I came to know had been to Bhutan already and had helped the Ministry of Health in developing the first cancer document. So as soon as I left to Australia in 2018, a team of nurses who had been to Kerala started home palliative care in Bhutan at the National Referral Hospital. It wasn't easy for them. I listened to their stories and it was very challenging. And
Yeah.
when people did not really understand, they also cannot really help and support. You know what I
Yeah.
mean? So these nurses are the heroes in palliative care in Bhutan. Today, we also have a palliative care physician. She's Bhutanese, trained in Singapore, and she leads the home palliative care team
Hmm.
today.
I would love to hear a little bit about, or like talk a little bit more about the early part of your story, because the one thing that I hear in those early experiences with your patients that drew you to even go to Google in the first place was witnessing the suffering. But what I hear in your stories is also about the spirituality and the emotional and the social impact that these illnesses had on your patients. And I would love to kind of dive into a little bit more about what is it about palliative care, now that you've done all of this training and done all this education, that has created such a passion for what this work is and why it's so important that places like Bhutan increase and continue to work on building their programs. Now that you've been in it for a while, what is it that keeps you passionate about palliative care?
Yes. So when I started learning about palliative care, as I read more and more about palliative care, I started reflecting to what I witnessed in my patients that I cared for in the past, you know. I used to have patients and families, especially when it was children, who could not afford to buy medicines. Like
Mm.
in Bhutan, the whole medical care is funded by the government, but especially when it comes to pediatrics, sometimes because those days not all the syrups would be supplied by the government, you know, it would be mainly tablets. And we would want, when the doctors advise syrups for children, we advise the families to buy. But there used to be families who could not even afford to buy a bottle of syrup, like syrup paracetamol, you know. We will give them a piece of paper, write the name of the medicine, and then ask them to buy. But next
Mhm.
day they would not have bought. But not everyone had time, but also passion to sit with the person and ask why they couldn't buy. You know, some of us would
Mhm.
say, why? Why didn't you buy it? But then
Mhm.
when you really sit and talk to this family, they'll say, I don't have money to buy. When it comes to chronic illness, although medical care is completely funded by the government in Bhutan, and also I know in many of the low and middle income countries, people are after cultural and spiritual aspect of that care they
Mm.
avail. In Bhutan, religious rituals plays an important role, especially when there is a chronic illness, death and dying. But then all these rituals also involves lots of expenses.
Mhm.
So I realized while these rituals, prayers, offerings all means a lot to the family, it also costs the family.
Yeah.
And there is that financial burden. In my research on the needs assessment for palliative care in Bhutan, besides the physical needs like pain relief and all those,
Mm.
financial burden was one of the main issues the families
Mm.
faced.
Okay.
Both the patient and the families reported that financial issues. Some of them had even sold their properties like
Oof.
land, cars to
Mhm.
avail treatment, you know.
Mhm.
And it is not to pay the medical bills, because, as I said, the government pays it, even when the patient needs to be referred to India for advanced treatment, the government
Mhm.
pays. That way, we are very lucky in Bhutan. But
Right.
then it involves other aspects of care. You know, traveling is one thing. Patients from remote places needs to come to the referral centers, and it
Yes.
involves cost to travel. But it
Absolutely.
also involves lots of money to have these rituals performed.
Mhm.
Yeah. And so sometimes they also do need to buy medicines which are not in the essential drug lists, you know. So
Right.
also what I felt when someone is confronted with an advanced illness, it's not just the patient, but the whole family who is affected. So that's how my interest really developed on palliative care. What a beautiful concept to be able to help the patient and the family together. Communication is one of the biggest challenges faced, I noticed in Bhutan, because we have limited doctors.
Mm.
There is huge shortage of nurses. There's no time to talk to the patient. All the patient and the family wants is someone to talk to them, explain to them what's going on, what's their
Mm.
future like, what's going to help, what's not going to help. But there's
Mhm.
no time. And also, when our doctors and nurses did not know about palliative care, many feared to talk about the grave outcome of the patient.
Yeah.
You know, I'm a very emotional person, you know. I at times feel like breaking down, listening to patients' story and trying to help them understand what the journey like going to be for them. I can cry, but I can still be with them. And that's
Yeah.
what keeps me going. Yeah.
You care for them in a compassionate way where you really want them to feel heard and that you're caring for them as a whole person, that holistic, physical, emotional, spiritual, social, as well as, who they're a part of, their community, their family. It's not just their medical problem that you're paying attention to. Clearly your heart drew you to compassionate care that involves so much more in communication in an intentional way so that these people do feel heard and supported. I'm curious what you think about the role of nurses in Bhutan because our experience has been in a lot of other places in South Asia that we train a lot of physicians and it's hard to find nurses who maybe want to or can because of workload and things like that want to do that training. And I feel like a lot of times our training becomes very physician heavy. And Bhutan, I think, is an exception to that, where you as a nurse and your colleague as a nurse then stimulated more nurses to go train in Kerala. And then those nurses are the ones who started the community care program. Like, what a powerful story of the ability of nurses to really create change. What is the role of the nurses, and where did some of that come from?
Yeah, so that's a very important question. Initially, I think most of the time nurses felt that, okay, we need to follow what the doctors say, we
Mhm.
need to do as per the doctor's order. But then I think some of our senior nurses also has led. They went beyond to study and gain qualifications, and so had already inspired us that nurses can also lead and make a difference. And
Mm.
also, I think in my own case, having found this subject, having experienced, having gained a training there, and then having gone back, we thought when we led, when we wanted to help people understand important stakeholders like doctors, medical directors, nursing superintendent, president of the university, all
Mhm.
of them actually regarded this as a very important step towards helping our patients. So I think in Bhutan, given the opportunity, as I said, there's always a shortage of nurses and manpower in the country. And
Mhm.
today, Bhutan is facing a huge challenge of youths moving overseas. I'm also currently in Australia. I came to study. My whole mission was to go back to Bhutan and contribute in developing palliative care in Bhutan. And so when I completed, I went back to Bhutan and started advocating, educating on palliative care.
Mhm.
But when I went back, my family remained in Australia. I have two children. They are both studying here, and so my husband had to stay with them to take care of them. We all thought things should be okay. Like I'm back home and they are here and I have my brother and sister-in-law. But then after 1.5 years, we realized things were really not working well,
Mhm.
having to live in two different hemispheres.
Right.
Coming back to your question, nurses in Bhutan, given an opportunity, can do so much. Before we had a palliative care physician in the country, it
Mhm.
was a nurse led palliative care program.
Yeah.
A doctor would accompany the group to visit patient, an oncologist would accompany the group, a pain specialist would accompany the group, but it was a nurse led program,
Yeah.
and they played such a critical role. They made presentations, they attracted people to help and support them. The royal family supported the team in many different ways. Although it is gaining momentum, pediatric palliative care. I
Mm.
would like to share about pediatric palliative care as well. Two of us are facilitating an online 8 weeks pediatric palliative care course through Two Worlds Cancer Collaboration and other organizations for the nurses in low and middle income countries. And I'm really
Mhm.
excited. I'm really excited to be part of this.
I'm so
Yeah.
glad you mentioned that, because that was kind of where I wanted to go next was, what is next on the horizon? And I'm also really excited about this because I think it's the first of its kind, really, to focus. We've always had mixed groups. So Two Worlds has always invited any providers, any kind of healthcare workers that were interested in learning about pediatric palliative care, come to our echoes, come to our online training. But this is the first of its kind, I believe, that is focusing on training nurses in the area as well. And a lot of these nurses that maybe don't feel they have a role or they don't understand what their role in providing this care is, the fact that the program in Bhutan has been nurse led and from the ground up has been run by nurses is such an inspiration, I think, for other nurses in other low and middle income countries to know that they have power to enact change, that they can really care for their patients in a beautiful way, and really hopeful to see what comes of this program that you guys are facilitating, because I think if we can inspire and light a fire under some of these nurses, I agree with you. There is nothing that they can't do. I think we could see a whole new wave of change that they'll be able to also inspire other people like you did. One colleague at a time, inspiring things until there was a whole community program.
I completely agree because in my own case, initially, it was mainly on adult palliative care in Bhutan,
Mhm.
really picking up. And the home care team were mainly focused on adult palliative care because none of them were really into pediatric palliative care. Although children did get referred to them and they still
Mhm.
did what they could.
Yes.
But then without pediatric palliative, because although the concept of palliative care is same with both children and adult, there are certain differences when it comes to children, especially
Absolutely.
because they cannot make their own decisions and
Mhm.
lots of things has to be dealt with families, although in adult as well we care for patients and families together, but then there's slightly different given the age of the patient. Since the early 2024, I started reaching out to pediatric department at the National Referral Hospital. I felt very comfortable because I had worked with the team many years ago as a pediatric nurse. So I
Right.
approached the head of the department, and the first session I did introduction to pediatric palliative care was for the doctors, including
Mhm.
pediatricians, residents, and interns. I think there
Fantastic.
were around 10 to 15 participants attending this session. And I was mainly presenting on what the concept of pediatric palliative care is, how we could together work for the patient's well being. And thereafter, I did two more sessions for the pediatric and neonatal nurses at the National Referral Hospital. And people
Mhm.
just started becoming interested. So in 2023, I facilitated a 6 weeks online training for pediatricians and nurses with help from Two Worlds Cancer Collaboration and Hyderabad Center for Palliative Care. We
Mhm.
had around 40 participants, including pediatricians, residents, and nurses working for children in Bhutan. I applied for this leadership in pediatric palliative care program, and I was among the 18 other scholars from Southeast Asian countries doing this year-long leadership program on
Mhm.
pediatric palliative care. And my project was on developing the knowledge and skills on pediatric palliative care among healthcare professionals in Bhutan. So
Fantastic.
that's how I could also travel to the regional referral hospitals, introducing the concept of pediatric palliative care. As a part of the leadership program, my mentor, Dr. Spandana Rayala, would come to Bhutan in 2024. And at the National Referral Hospital, while she was there, we had a child at the end of life in the
Mm.
intensive care unit. So it was a very good opportunity for our clinicians to attend to a bedside teaching, family meetings, and then other care aspects. The team really appreciated that.
Yeah.
And after Spandana had been to Bhutan and then inspired the doctors there, one of the senior pediatricians decided to do the fellowship in pediatric palliative care. As a nurse, I did my best for pediatric palliative care. At times, I feel guilty of having not been in Bhutan at this time,
Mhm.
where I
Mhm.
could have contributed so much, I feel. But as I said, family became priority number one. And
Yes.
so I still continue to facilitate in whatever way possible, especially with pediatric palliative care, in facilitating educational sessions for my colleagues back home.
Perfect. And now you're facilitating this nursing project as well. I think there is only an upward movement. Everything that you seem to touch just seems to inspire and move things forward. So I just wanted to say thank you so much, Tara, for taking the time to share your story. I love your storytelling, and it really draws in the humanity of this work and the compassionate heart that you have. I'm really excited to see where all of this goes. I have witnessed how far it can go in a very short period of time in a place like Bhutan, and with people like you behind it, I think it's only going to grow even more. So I'm excited to see where this nursing education sessions go and where pediatric palliative care goes in Bhutan. Again, thank you so much for spending the time to talk with me and also just being willing to share of yourself and your story.
Thank you, Rachel. Thank you, in fact, for giving me this opportunity. And I'm hopeful that this story will inspire many others, especially nurses in developing countries. And I'm hoping this 8 weeks online training on pediatric palliative care will also help nursing colleagues in the low and middle income countries
Mhm.
to be able to provide much more than what we already have been doing to our children and families facing this very, very difficult part of their lives. Yes, thank you again for this opportunity.
Thank you for listening to this episode of the Sunflower Palliative Care Podcast. The Sunflower Podcast grew from the seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer Collaboration, which focuses on children's palliative care. We hope to build a world where no child suffers from serious health-related issues. To learn more or to donate, please visit twoworldscancer.ca.